and welcome to Grand Round's presentation. And it is our great pleasure to always have our residents participate in Grand Rounds, and we really look forward to this morning's presentation. We have Shelden, Kyle, Tejas, and Maria, all of whom are third-year residents in our program, and really have had the interesting experience, although challenging as it may have been over the past year, to engage in their learning and the impact that COVID-19 has had on that. And today they're going to, they all have a particular interest in education. And today they're going to share with us their some aspects of their experience with learning through the COVID period. And so in effect, what we will have today is a virtual teaching session on virtual teaching, and or I should say virtual learning. So I'm going to hand it over to Tejas, who's going to lead us through and introduce the topic.
Great. Thank you very much, Dr. Duffy, for that kind introduction. Okay, so we'll get started here. So as Dr. Duffy mentioned, we'll be talking a little bit today about education in general, virtual learning in particular, and how it's changed throughout the COVID pandemic. So just as sort of a brief outline on what we want to cover today, we'll start off by talking a little bit about how education has changed, and then focus in a little bit on Canada specifically, but also talk a bit about worldwide virtual learning. And then we'll briefly touch on health-related impacts with the COVID pandemic. It's a very big topic on its own, so we'll focus mainly on education, but touch on some of the health-related outcomes. And then finally, at the end, we'll sort of wrap up about what strategies based on available evidence and literature have worked or not worked so well, and where do we see virtual learning going into the future beyond the pandemic once life hopefully returns back to normal in the near future. So in terms of why we sort of chose this topic, we were brainstorming about, what should we talk about? There's so many things going on. COVID is the obvious choice. And then we sort of got talking about different ideas, and we realized we had so many patients who we'd encounter, and somehow education or school always came up. And I'm sure it's the same for everyone on this talk today as well. And then we started looking into the literature a little bit, and just even if you Google search education and COVID-19, I think last check there was something over 700 million hits on news stories and over 4 billion or something like that Google hits that you get if you search those two terms. And this is just a sort of collection of some of the news stories that we came across. And I always think a good sort of litmus test of how important or relevant a topic is if there's a Wikipedia page on it, which is what's down here at the bottom. So we thought this would be a great topic to talk about, something that there's lots and lots of controversy and opinions on, and something that we experience on sort of a daily basis with our patients as well. So if we look a bit further into how exactly has education changed, there are so many different things that we could cover or discuss. And here I've just sort of outlined some of the bigger themes within education and how it's changed. So first of all, there's so much variation with how education has changed, and it varies regionally within a country, within provinces, even within province, for example, in Canada. There's so much variation here in Ontario, depending on rural areas, urban areas. So lots and lots of different approaches that are very tailored to the particular community. We've seen that students have had really no consistency. The pandemic has been fluctuating, and because of that, education has fluctuated a lot as well. You may have weeks where you're in person, and then all of a sudden you're back to virtual learning, or you're out of school completely. One thing that we've encountered with some of our complex care or special needs patients is that a lot of the special needs support has essentially stopped for long periods of time, which has been really detrimental to their care. We've also found that this has placed a really high burden on families in particular. Not only are parents forced to become teachers, but they may have the added stress of having job losses and now needing more equipment. If you have 3 children and 1 computer, that's going to be a bit of a problem at home. So how do we sort of deal with that? And there is some evidence, which I will touch on later, on some of the differences with socioeconomic status and the impacts that it's had switching to virtual learning. And then finally, the point about how it's impacted children and mental health or performance, there's quite a bit of variability here. Some children or students have found that it's easier for them to work at home. They get work done faster. Others have really struggled with the loss of social interaction and some of the added supports at school. So I always thought this was just kind of a good visual. I've always been a very visual learner. And so if you just looked at Google Images and how education has sort of changed around the world, I thought this was a good representation of how COVID-19 has affected schooling. So this top left image here probably reflects what we see in a lot of students here in North America or Canada, the Zoom culture. Definitely spacing children out. Many places around the world have tried outdoor education where possible. And I just found this image on the bottom left here. I feel like this could be sort of a Time cover story. This girl looks so sad down here and sitting all alone eating her lunch. So it certainly reflects the variability around the world and how it's impacted children variably. So to transition to what does the literature actually show? So this is, I'm just going to briefly touch on this and we'll cover more of this later on in the presentation. But what we found when we start to look into hard science in some of the literature is that it's quite limited in terms of actual data. A lot of the evidence that we have so far is primarily based on either surveys sent out to various groups or various reports created by educational bodies or large organizations. And interestingly, there is actually a lot of study into higher education, the university levels, and especially medicine. Dentistry had quite a bit of evidence. And one particular report that I found interesting was one that was put out by UNESCO, which they actually sent out surveys around the world to all different higher education administrators, professors, whoever they could find, and it was something like 450 different institutions around the world. And they basically surveyed these institutions looking at, well, what is the impact that COVID-19 has had on your institution? And many of them, I think it was about 60%, said that they had to completely shut down for a long period of time. They found that it's impacted their enrollment for the following years. It's affected research, student outcomes. Virtual transition has costed them a lot more money as well. So lots and lots of negatives. But interestingly, they did say that in the future, they will likely transfer to more hybrid curriculums, at least for a lot of their subjects, since many students have found it easier. You don't have to commute, you don't have to be on site. And so we'll see sort of what the future holds. And then just the second point I made down here is just focusing a little bit on impacts beyond the classroom. So we've talked a lot about education and within the classroom and the impacts on students, but we also forget that schools do a lot more than just teach students and educate them. There are nutritional programs, especially a lot of the literature was from the United States, which have had tremendous impacts on different populations. School care, sports, physical activity. I mentioned special needs earlier. And then I did touch on the minority groups and lower socioeconomic status groups, which have been particularly affected. And a lot of the literature in the US has started to look into that in a bit more detail. And then the final points, which I've listed here, are related to a good growing body of evidence on obesity, screen time, and mental health outcomes. And I did discuss that there is some variability in terms of mental health impacts on students, and it does really depend on the student in particular and how they learn and what experience or environment they find most helpful for them. So if we transition a little bit to focusing more in on Canada now, what's sort of the impact we've had here? So thankfully, there's actually been a couple of very useful websites which summarize this quite nicely and make it useful to look at. So just like everywhere else in the world, within Canada, it's quite a variable approach depending on the province and the regions. And the investments that provinces or regions have made have been anywhere from 50 million in the smaller provinces, up to over $1 billion here in Ontario. And as is no surprise to anyone, there's combinations of in-class and virtual learning depending on the time of year or time of the pandemic. And then there's also quite variable health and safety protocols. So different provinces have taken different approaches. Some have gone with masking for sort of all across the board. Others have done based on the pandemic and how severe it is. Others also have different sort of levels of safety and health and safety protocols depending on regional restrictions and public health guidelines. Depending on the classroom and the age group, they've also done different things such as alternating in class and virtual learning, or every other day you're in class, or hybrids. And of course, I mentioned, but the cancellation of extracurriculars and sports for the most part, although very recently, I think it was this week, a lot of that is starting to slowly transition back at least. And so this is a website that I mentioned here, and I found it's quite helpful because it sort of breaks down different provinces, what their plans have been, and then the health and safety protocols, how they are going through with the actual learning, and then what sort of investments the provinces have made. And this is fairly up to date, almost on a weekly basis. They seem to update the website. So it's quite a helpful and easy tool to go through and say, hey, this is what's going on and what's happening in my particular region. Okay, and so with that, I'll hand it over to my colleagues who will go into a bit more detail about education and in Canada and where we are at now.
Great, thanks so much, Tejas. So obviously, the title of this slide is impossible to go through in 10 minutes or less. I just wanted to identify a few buzzwords and a few themes that myself and Shelden will touch upon in the slides to come. And bear with us as we coordinate clicking and clicking through the slides as 4 separate people. So Tejas is the lucky person who's going to be clicking through the slides. So I'll ask him to go to the next one. Thank you. Okay, so I'm not going to be going through tons of numbers, tons of stats or anything with you guys, but I think to appropriately frame the topics to come, we need to take a quick survey of the numbers. So far in Canada, we're sitting at just under 1 million cases. Of which about a third have occurred in our province of Ontario. And of these, of the symptomatic cases, about 15–16% of them have occurred in youth. Interestingly, in Ontario, 9,000 of the roughly 300,000 cases are school-related, touching about half of Ontario public schools. And these school-related cases correspond to about 3% of the total case burden to date. Go ahead, Tejas. So this is a bit of an aside, but I thought this was a pretty cool find. So this is a COVID-19 school dashboard, and it is a not-for-profit real-time updated, well, real-time daily, let's say updated tracker of all school-related cases in the province of Ontario. And you can zoom into the different regions, the different schools. You can change the demographics you're looking for. So if you are curious, I encourage you guys to check it out. It's by a public health and education expert out of Western University. And again, just to frame things, moving back through a bit of a timeline. We're almost at exactly a year ago, March 12th, 2020, which I'm sure is seared into the brains of all the parents in our virtual audience today. That was the day that the government of Ontario announced that all publicly funded schools were to be closed at that point for 2 weeks. Obviously, that was extended through to the new school year in the fall. And this affected the 2 million students attending our roughly 5,000 public schools across the province. And again, we did have a more recent suspension of in-person learning at the peak of our second wave early in the new year. Okay, next slide, please. Okay, so how I wanted to approach this was I was curious about how the current positions of various pediatric bodies came to be informed by the evidence. And I wanted to sort of track the evidence as it emerged through the pandemic and how it seemed to inform decisions surrounding school closures and what have you, which is why I wanted to start with the timeline. So, having reviewed all the numbers I wanted to review, taking us back to the start of the pandemic, let's talk about what we knew. So we knew that the virus reliably spread person to person. We knew that, shockingly, children and youth efficiently transmit all other forms of viral illness, flu, respiratory tract infections, etc. And it also seemed that asymptomatic infection appeared to be higher in children. As we moved through the pandemic, again, shockingly, we found out that kids could spread the virus. They could spread it through various settings, including the home, including school, summer camps, etc. There's an emerging body of evidence suggesting that younger children, meaning under 10 years of age, may transmit the virus less effectively than older populations. And not to undermine the importance of MIS-C, or severe respiratory illness in pediatric populations, but we have learned that the burden of severe disease is significantly lower in our pediatric population. Okay, go ahead, Tejas. Okay, I was curious though, what about schools in particular? So I wanted to take a look at what information was available surrounding the impacts of school closures or openings through the spread of the pandemic. And I'm super guilty of cherry picking things here, so bear with me. But the evidence available earlier on through the course of the pandemic was somewhat conflicting. Some early modeling data from China did associate school closures with improvements in some measures, of community disease transmission. And a larger study, this one was out of the Lancet, surveying about 130 different countries, that did identify some temporal associations with school closures, openings, and community transmission. However, again, as we move through the pandemic, we learn more, we develop more focused questions and more robust studies, including one that is homegrown out of Ontario, which in summary suggested that infections in the school were driven by community transmission rather than transmission within the school itself. So, and this was backed up by a study from the States, which associated new infections in children and youth with a few things, including known exposure or exposure to a known case of COVID-19, gatherings with people outside of the home, having visitors in the home, but not with the reopening of schools. So that was sort of the way the data not changed, but emerged through the pandemic. And I think rather than continuing to cherry pick further studies, this is a summary statement that I think sums it up best, which is that evidence as it currently stands suggests that school opening with variable health and safety measures in place has not played a significant role in propagating SARS-CoV-2 transmission in the community, which is a fairly impressive statement. And this is coming from a report that is authored by a multidisciplinary team of pediatric experts here in Canada. It originally came out of Sick Kids, but has since received contributions from pediatric providers across the country, or across the province, I should say, including our own Dr. Huey, Dr. Thampi, and Dr. Sampson from the infectious disease team here. You can click to the next slide, Tejas. This is just to highlight that document, which I drew from heavily for my little spiel. But I wanted to, like when we talk about variable health and safety measures, precautions, what are we referring to? So I thought this was a nice infographic. It's an inverted pyramid arranged from most effective interventions to least effective, with the most effective being at the top. And to summarize it for you, essentially at the top is preventing the virus from getting into schools in the first place. And this relies heavily on screening, it relies heavily on testing capability and contact tracing, not unlike the process we use to come to work every day here at CHIO. As you move down the inverted pyramid, we see modifications you can make to the physical infrastructure of schools, ensuring that they have adequate ventilation, cohorting students, which Tejas showed through a few of his images earlier, hand hygiene, outdoor education, which obviously is super effective in a country that has -20 winters, and at the very bottom, PPE. Go ahead, Tejas. Okay, and this is just to show that this is a Government of Ontario resource, which has suggestions for essentially along all of the parts of this pyramid for the safe reopening of schools. It's pretty cool. I clicked through a few of these. They're really accessible instructions, and just to sort of show you that this resource is available. Go ahead, Tejas. Okay, jumping, this is sort of the last part of my talk before I hand it over to Shelden, but I wanted to go through a few of the recommendations by some of the major pediatric bodies that we have access to. So this is a summary statement from the document. I labeled it as Sick Kids, but it's the summary or the report that I made reference to earlier. Based on the available evidence, it's our view that the adverse impacts of school closure on children and youth are such that school closure should be used as a last resort. The CDC backs up that claim. Schools should be the last settings to close after all other mitigation measures in the community have been employed, and the first to reopen when they can do so safely. Go ahead, Tejas. The American Academy of Pediatrics strongly advocates that all policy considerations for school COVID-19 plans should start with the goal of having students physically present in school. And from the Canadian Pediatric Society, a safe return to school guided by evidence-based policy that meets the unique physical, social, emotional, and developmental needs of children and youth is essential. So this is fairly strong, consistent messaging from everyone. And if you look at UNICEF, UNESCO, what have you, their messaging is all congruent with these statements. Go ahead, Tejas. Okay, so it's great that we do have such a consensus, but how that is translated to the individual person can be a little bit complex and complicated. These are all article headlines from the last month. The two on the left are from the New York Times, the two on the right are from Canadian sources. And I draw attention to the one on the bottom left. Having just read that statement from the CDC, we have an article, front page of the New York Times, saying that only 4% of the nation's school children live in counties where coronavirus transmission is low enough for full-time in-person learning. So the messaging, if I was a parent, I would be rightfully concerned about that messaging. So I think all we can do in the face of this is to continue to have open dialogues with our patients, with our pediatric patients as well, and to understand their perspective and to talk about these recommendations and these news articles as they come about. I'll go ahead, Tejas. So regardless of the way or the modality through which education is being delivered, kids these days are going through a radically different school experience than any of us have lived through. And we are starting to see some unintended consequences of the way education is currently delivered. And Shelden, who is up next, will take you through a bit of these.
Oh, sorry, I just realized I was on mute, sorry. So before I go on to talk about the mental and physical toll that virtual learning is having on kids these days, what I'm gonna first chat about here is some of the challenges that both students and teachers are having with virtual learning, and they're quite numerous, as you can see. The first and foremost being that while most students do have electronic devices these days, they might not have the right tool to do the job. And one study that was a little bit alarming, or one finding that was a little bit alarming for me, was that Really only 20% of 8th graders don't have a laptop or desktop computer, which to me sounds like quite a lot. And I imagine doing homework in class will be quite difficult with having one of those. In the US, 4% of 8th graders lack home internet, which would obviously make virtual challenging, next to impossible to do. Additionally, even if they do have a device in the home, they might not have enough devices to support all of the children in the home, or perhaps parents might need to use that particular device to work from home, which obviously makes things challenging. Additionally, the effectiveness of virtual classes are not yet clear, and some research has shown that really for virtual classes to be effective, the students themselves need to have a lot of buy-in and motivation, and really a lot of parental supervision and outside support to really help them succeed with virtual learning. And additionally, and I guess probably most relevant for COVID, is that really students haven't had a chance to really learn how to learn virtually, because the change to virtual learning was very abrupt, and students didn't really get a chance to learn how to use all of their electronic devices in a education capacity, where previously they would use it for really leisure. And obviously there's lots of distracting content like social media and video games and stuff that are on these devices, as well as just the internet. So obviously the devices can be distracting, and of course internet quality can vary widely, sometimes even day to day and region to region, which may make the delivery of virtual learning very challenging. Next slide, Tejas. Teachers themselves are also having some challenges with virtual learning. Many teachers do not feel that they've been adequately prepared to deliver their lessons online. Again, for them, the transition to online learning was abrupt, and they didn't get much of a chance to develop any teaching tools. And a lot of research has been done that shows that for online learning to be effective, they need to have really carefully designed lessons that are really built for online learning, which obviously has not really been the case for most of COVID, as most teachers didn't even think about delivering their classwork virtually until COVID unfortunately forced them to do so. In addition, teachers do find that there's weak technical support systems in place with regards to things like Zoom and other tools. And when things go awry, then there's a lot of lost time and missed content. And there's really been a lack of education regarding how to integrate the technology into the classroom. Furthermore, there's not really a great way to track attendance, and obviously even the best teacher in the world isn't going to be an effective teacher if people aren't there to hear their instruction. And what the surveys are finding is that the biggest drop-offs in terms of attendance tend to be between the youngest and the oldest students. Obviously, the youngest need the parents' help to be able to get them online. So sometimes the parents aren't always available or aren't always aware or really understand how to solve the technical problems. And older children often are the least motivated, so they say. So they may be truant from the class. Additionally, their teachers are finding that it's difficult to maintain or really obtain an emotional bond with students, which is negatively impacting their teaching. Next slide, please. Won't go into this slide too much as we're a bit strapped for time, but this is a 2017 study I found, or rather a survey that I found about virtual learning, and it essentially shows that although most children do have internet at home or a device at home, you can see that very few are really have any experience using those devices or the internet for homework, about 50%. And that you can see that teachers do not feel that they are very proficient in using software or computers for instruction. And what you see, there's all students, non-poor and poor, and poor here is defined as students that qualify for a subsidized meal program. This was taken from the United States. Next slide. So as we sort of mentioned earlier, UNESCO has a lot of great resources and has a lot of data about virtual learning and COVID. And one thing that I found was particularly nice was this one page here where they have approximately probably about 100, if not more, resources for not only students, but parents and teachers to help them deliver online classes. And these are different software, courses, all kinds of different tools that I think all teachers and parents and students should have a look at, as it might help them. Next slide. So next, I'm going to talk a little bit about the mental health toll as well as the physical toll that virtual learning is having on the kids in school these days. Obviously, oh, can you go back? There's a fair bit written about the mental health concerns. Research has shown that the school environment is critical to foster an academic motivation as well as social development, and many students rely on schools additionally for mental health care. People feel that working alongside a friend or asking a teacher for guidance will allow students to feel connected to others, and that sense of belonging actually influences students' engagement in class. And really spending time with friends is often the student's favorite part of school, and without that sense of belonging, it actually may be harder for kids to stay focused on their work. Additionally, there are a lot of worries that kids are losing confidence during distance learning because it's a lot more difficult for teachers to provide individualized feedback. And a lack of one-on-one interactions with teachers and peers is also likely to have an impact because those interactions help students develop fundamental social and emotional skills, which of course is lacking when they're being taught virtually. Additionally, some students may be particularly uncomfortable if they're forced to keep their camera on during class, because we're allowing students and peers and teachers to see into an intimate part of their lives. And a lot of people might not want others to see that, especially if they live in a kind of an unstable environment. Additionally, children with ADHD and other behavior problems are more likely to suffer academically and psychologically during distance learning. Next slide. The toll goes beyond mental health. One common concern that I found online was for eye strain, and there's a number of articles out there written by ophthalmologists with recommendations to prevent this. And the American Academy of Ophthalmology has recommended that students adopt what they call the 20-20-20 rule to prevent eye strain. So that basically says for every 20 minutes in front of a screen, take 20 seconds to look at something at least 20 feet away. Additionally, they also recommend good ergonomics to rest the eyes. So what they recommend is you want to make sure the laptop is at arm length. You want to reduce the glare, and do not position a light source behind the back. Behind the back of the computer screen, you want it to be behind yourself, and obviously to adjust the brightness and contrast so it feels comfortable. And do not use it in a dark room or out in the sun where their glare can be worse for the eyes. And obviously to take a break 30 to 60 minutes before bedtime. Next slide. There are other ways that online learning is affecting student health. We mentioned, sort of mentioned earlier about the screen time. So with virtual learning, there is increased screen time per day, which can potentially disrupt circadian rhythms and altering sleep cycles. In addition, some worry that this might cause any increased addiction to internet and phones and other electronic devices. Additionally, some states have seen an uptick in obesity. A couple of reasons for that. There's a decreased physical activity, even as much as not walking between classes or going to gym classes. Those things are now absent, but there's also been a significant change in sleep and meal scheduling. Now, if children are at home, they can essentially just sleep as long as they want, or nap as much as they want, and hop over to the fridge and grab a snack at all times of the day, which is not doing them any favors. In addition, they feel that there is a delay in social and emotional learning, which they refer to as Zoom fatigue. Essentially what this is that online video calls are socially draining, as it takes a lot more work to pick up on social cues, and when you're not seeing people's faces and bodies in real time. And a typical video call will impair these ingrained abilities and require sustained and intense attention to words instead. That's what they call Zoom fatigue. Additionally, there's a number of MSK issues that can result from poor ergonomics and posture. As you can see in this cartoon here, this is how most students study at home, I imagine. It's interesting because businesses all around North America have been crafting ergonomically correct workplaces for years. But when students come home to study, they're really, for the most part, I think, hasn't really been given much thought. So in order to prevent, issues with your shoulders and neck, you want to keep the computer at eye level and minimum of 20 inches away. And most laptops, which most students are using, really don't fit this bill as the screen is too low and you're often looking at an angle downwards, which can be draining. Next slide. Other potential issues that are feared are reduced adaptability, resilience, and coexistence skills due to moving away from the classroom, decreased face-to-face communication skills, and increase in student cheating on exams. And next slide. And lastly, I won't go through these, but if you're interested in looking them up, the American Psychological Association has a list of 9 tips for students, teachers, and parents on motivating children to learn from home. But for time, I won't go through them. And now we'll hand it over to Maria to discuss the strategies to improve virtual learning.
Thanks, Shelley. All right, so you can go to the next slide already, Teach. We'll try to do this for time's sake right now. So really, there are so many resources online that try to provide useful tips for students who are learning virtually. However, it can quickly become very overwhelming for both parents and teachers. So I found these kind of like infographics from a US-based hospital that I thought were kind of both cute and straightforward. So I thought I'd share them here. And super briefly, one of the recommendations is to invest in blue light glasses, which is controversial to say the least, and I know has varying levels of evidence. However, they have been proposed to at least improve the circadian rhythm of children, so something to consider. Another thing is to take frequent breaks to reduce stress and anxiety, which will also help kind of improve the focus and productivity of children. And they actually suggest that elementary students take 3 to 5 minute brain breaks for every 10 to 15 minutes of learning, while high school students should take a break for every 20 to 30 minutes of learning. They also recommend getting in at least 60 minutes of exercise daily and designating an area of the home as the student's personal learning space, which should be free of distractions if possible. However, that's clearly very difficult and becomes even more difficult when there's more than one learner in the home. Lastly, they should be scheduling learning and studying time separately. So there should be a specific block of time that's designated towards learning new materials, while another block of time towards learning or kind of reviewing what you've already learned. And while my main objective was initially to kind of explore these types of strategies to improve the virtual learning experience for our students, I quickly realized that there's really no point in belaboring on these strategies if our students don't all have equal opportunities to access their education. And by opportunity, as we kind of mentioned before, I mean basic accessibility to virtual education. Teague, you can go to the next slide. So it's no surprise that there were a number of students without computers or access to reliable internet when virtual education was launched at the onset of the pandemic, both of which would preclude their participation in virtual education. However, most school boards in Ontario were actually fortunate enough to receive additional funding from the province and elsewhere to help purchase and distribute technology. So in particular, when the Ottawa Carleton District School Board reached out to its students in March of 2020, they found that approximately 7,000 students were in need of digital devices, and 2,500 students did not have reliable access to the internet in an urban center. So in response to this, the OCDSB actually began quite an ambitious effort to distribute 7,000 Chromebooks from their schools, and they purchased 1,700 internet hotspot devices for these students. Unfortunately, though, not all school boards were really able to meet these types of targets and demands. For example, the Durham District School Board in Ontario had to limit device distribution to one per family for elementary students due to the shortage of devices. But this meant that families with more than one child at the elementary level were sharing devices. So they weren't really able to fully participate in their virtual education. And to give you an idea of how much the demand truly was, at the height of the second wave, the Toronto District School Board said that it was receiving approximately 100 new requests for loaner devices each day from families. Next slide, Tej. And then when we go in terms of internet access, Canada's vast landscape with varying geography and climate obviously presents unique challenges in providing high quality broadband internet access service for all Canadians. In particular, there's many rural and remote areas that don't have services comparable in terms of speed or capacity, quality, or price to what's offered in urban centers. And so then the Canadian Radio, Television and Telecommunications Commission, otherwise known as the CRTC, they reported that approximately 55% of our rural households in Canada do not have access to 50 megabytes per second download speeds, which is what our federal government considers to be our minimum speed target for service that delivers the features of the modern digital economy. Next slide, Tej. So then to kind of close this digital divide that we have between our remote and urban centers, obviously the existing infrastructure in Canada needs to be upgraded and new infrastructure needs to be built. However, this obviously will require a great deal of time and money and a collective effort from all levels of government and the industry. And then you kind of enter into the game of politics. So in November of 2020, the federal government announced that it was actually on track to connect 98% of Canadians to high-speed internet by 2026. However, as usual, the answer to our problem always involves money, and a lot of it. So the Prime Minister announced that Ottawa was set to launch a universal broadband fund worth $1.75 billion. And then senior officials at the Department of Innovation, Science, and Economic Development said applications will be reviewed on an ongoing basis with the goal of having these projects completed by mid-November of 2021. But I was also wondering, who are the major players in this application game? Next one, Tej. And so enter Elon. So while Elon Musk's name is notoriously associated with like expensive cars and a recent slumping stock, he's also known for just not being a really good guy at times. However, his borrowed/stolen ingenuity does offer us a solution. I may mispronounce this name and I apologize, but Pigankakum is a First Nation flying community of 2,800 residents in Northwest Ontario. And their internet download speeds were noted to be approximately 2 megabytes per second, which is clearly a fraction of the 50 that Canada considers to be our standard. So then in comes Elon with Starlink, which is a new high-speed internet service provided by his US-based SpaceX firm. And it was actually recently approved by the CRTC. And beta testing was launched in this First Nations community, and they distributed 60 dishes to their homes and businesses. But with this technology in place, clearly their internet download speeds have now been exceeding this federal standard. However, it obviously comes at a price. So I was interested to see how much this actually cost. And I found that buying the dish and other gear needed for the Starlink service cost $649 plus tax. And users are then expected to have the ability to install the kit themselves. And then it's $129 per month for the service, which places the technology super far out of reach for most individuals. There are other companies that are trying to compete as well, such as Amazon, and there's a Canadian firm, Telesat, that recently signed a $600 million agreement with the federal government. So while it's clear that options do exist, they clearly come at quite a cost. And yeah, you can stay here, Teague, great slide. But it's really no surprise that virtual learning, on top of the previously mentioned challenges, seems to actually disproportionately fail to meet the needs of children with medical, developmental, and behavioral complexities in their families. To just give you an idea of the number of children that I'm talking about, back in 2007, which is now 14 years ago, so largely probably grossly underestimated right now, the Ontario Ministry of Education estimated that as many as 300,000 children had an individual education plan in the province. This means that there's 1 in 9 children in Ontario have been identified as having a unique learning need. And a great proportion of these children often have EAs and nursing support to support them within the school environment. So now many of these families have been faced with prolonged periods of home isolation to promote the health and safety of their children. But that's further compounded now by the lack of available respite and home care supports. So now these parents are playing the role of EA, SLP, OT, PT, nursing support staff, and teacher. So these are the families that we have to worry about. And school boards were very well aware of this fact early on, I think, and they were faced with a difficult decision on how to best accommodate the unique learning needs of these children. However, controversially and unbeknownst to a lot of people, the Ontario school boards actually mandated that the classrooms for in-person learning for students in special education streams open following the December holiday break. So while the Ontario government was telling a large proportion of families that it was too dangerous to send their kids back to school due to increased COVID prevalence, another group of families were being unfairly faced with the decision of whether to continue with a failing virtual education system for their children versus in-school learning. So this kind of prompted me to explore what strategies were being implemented to improve virtual education for this group of children. Next, Teach. So the major question here really is, how does one create a home-based instruction tailored to each student's unique needs? And some examples of suggestions that I found, and these are very generic, but kind of like early communication between families and teachers so that teachers can map individualized plans to available resources within the home. Another strategy is for that teachers should be tasked with evaluating which IEP goals are actually achievable within a home learning environment, and then work with families to break learning targets into manageable benchmarks. And then similarly, paralleling like a home learning schedule to a typical school day for children who really thrive on that regular routine. Considering the addition of sensory modifications and supports that can be put in place to optimize a child's learning. And then I read about a few interesting things. So one school board in Connecticut actually created a Google Classroom group just for parents with children with special needs so that they can connect with each other and swap ideas about what's working well and what's also not working at home. There are also some nonprofit organizations such as Communities in Schools of Chicago that were tasked with helping these students become more comfortable in their new virtual learning environment and helping their families as well. And then lastly, I was able to find this great resource called educatingalllearners.org. And it was formed by a coalition of more than 30 disability and education groups. And they created a digital one-stop shop of teaching resources. And they're kind of committed to resource sharing and community building to meet the needs of children with different learning needs during the COVID-19 pandemic. Next slide, Tej. And just for time's sake, this is just really like a brief snapshot of some of the resource categories available on their website. And it really doesn't encompass all the topics that are discussed on the forum. But what I think it does highlight is that our educators really do want to make a difference in virtual education, and they want to make it work for these students. So really, that's kind of the first step towards change. Next one, Tej. But kind of what alternatives do we have? So forest schools, micro schools, home-based pod learning, independent study education, and homeschooling were all kind of alternative models that I was able to find as I kind of explored what is out there. However, many of these options come at a price, and as a result, they seem to really exclusively be available to those with means and time. And that also kind of brings up the concern of the emergence of a tiered education system, which I won't go into today, but just to leave that in the back of your minds. So really, in the end, for the vast majority of families, educational accessible through a publicly funded system is really the only option. And we have to figure out how to make it work. Next slide. So really, where do we go from here? Can virtual learning still play a role in our children's education once the pandemic is over, despite all the barriers that it presents? And I think the answer is probably yes. So as the pandemic has highlighted the possibilities and limitations of online learning, and we all really look forward to the day that our kids can go back to a more traditional in-person teaching, I think they may elect to actually retain some of their virtual teaching capabilities for certain circumstances, like a hybrid model of education, perhaps. For example, if a child is sick with a sore throat and they're unable to attend school, but they're well enough to participate in parts of the school day, could he or she join in virtually for even part of the day? And if the school buses are canceled due to inclement weather, which seems to happen on a weekly basis most winters in Ottawa, could a student join in from home if unable to get to school? And I know that's actually been in the works in the Upper Canada District School Board as of this past year. And then basically, if a teenager would rather focus on another avenue of interest during the day, like a co-op position or an internship, could they not complete their homework on their own schedule? Next slide, Teach. So basically, like Gen Z and Generation Alpha are known as our digital natives. So those that have grown up in the digital age, immersed with computers and the internet. Therefore, it makes sense that one of the most formative experiences in their young lives should also encompass technology, and quite a bit of it. So I think we're certain that virtual learning will be an area that continues to evolve rapidly over the next decade, which will make these current growing pains that we're going through just sting a little bit less. Next. So really, in summary, really brief summary, because I know we kind of went a little bit over time. So it's very clear that our education landscape has changed due to the pandemic, and that there have been some both positives and negatives to it. However, it's clear that there's also been some effect on the health of our children and youth as a result of virtual education. I think we've highlighted multiple inequities that are apparent with the virtual learning landscape, but as well as strategies, but usually they're come at quite a significant cost. But I don't think that should discount the fact that virtual learning may actually have a role in future education, in the future for the education of our children. So I think that's wrapping it up. So I just want to thank everybody for tuning into our grand rounds today, and we're happy to take any questions.
So thank you all for your really excellent presentation, and I have to apologize for misleading people at the outset, where I suggested that this was a topic of the impact on resident education, and clearly it's a much broader and more important issue in many respects in relation to children overall. So thank you for educating us in relation to that. It's clear from a lot of the material that you presented that the impact on children and youth is substantial as a result of COVID-19. You alluded to the issue of children with medical complexity and others, but it seems that most of the solutions that have been provided really further disadvantage children from challenged socioeconomic backgrounds. I wonder to what extent you managed to look into that issue. Again, anybody wish to take that?
Tyler, Shelden, did you want to take that one perhaps?
Sure. So I can speak to that a little bit. So first off, beyond just the increased potential health consequences for children with medical complexity attending school, and that their exposure to the virus might result in quite a different health outcome compared to a developmentally appropriate, otherwise healthy kid. A lot of the themes that Maria touched upon, I thought she did a pretty solid job going through how children with medical complexity would be disadvantaged by virtual learning models as they currently stand. On top of that, in terms, as you mentioned, Dr. Duffy, in terms of social economic status, internet's expensive. Canada, it has one of the highest costs per person for internet access. So right off the get-go, as we've all struggled through various Zoom meetings with poor connections, for an effective educational experience, one needs a strong internet connection, right? The more remote you are, the less income you have to use towards a fast internet speed. One can presume the worse your education quality is going to be. So I think as it stands currently, until, as Maria mentioned, we establish a national standard such that everybody has access to reliable high-speed internet. It just by design is going to favor those who are more financially stable.
Great, thank you. A huge concern. Questions from our audience or comments?
Thanks, guys. This was a terrific talk and such a huge subject, and you covered a lot of ground, which is amazing. And I really appreciated the advocacy lens as well. Did you come across anything in terms of in your reading predictions for the future of what the impact potentially of this sort of like change is going to be, either on pediatric mental health or parent mental health from an anxiety perspective, or about what the foreseen impacts are of this kind of like interruption in learning, or on the impact of sort of, I would say, huge jumps in screen time for a lot of kids? Did you see any of that, and or you could just comment on your own thoughts?
Yeah, like I guess when I was looking through the literature, there isn't just a lot of literature on it right now. I think there's just a lot of postulation. So I think that we're actually going to get a lot of studies out of this in the near future, but there's just not a ton there. But I think that we're all predicting that there are going to be negative consequences as a result of kind of this delay in education, but hoping that it's not going to be too severe as to affect the development and learning of our youth. I don't know if anyone else wants to comment if they found something from our group.
I can just add to that a little bit. I agree with what Maria said, is that there's not a lot of hard data from what I found so far. And any of the data that exists is a lot of sort of expert opinion, or either expert opinion or survey based. And a lot of it focused on higher education, so university level. I found very, very little evidence actually at the sort of elementary or even high school levels. And from what I did find, a lot of it was variable. So in terms of mental health, it's quite a wide spectrum. Some students adapted to it very well and found the isolation allowed them to focus better and really perform better in school, whereas others found it really challenging. And I think it speaks to the variable socioeconomic status and adaptability of different schools as well. So there's so many confounding variables that I think it'll take time, and hopefully in the next couple of years we'll have better data as to what the outcomes actually are.
One thing I found that was kind of interesting, I saw a 2016 study that said that in grade 9, each week of absence per semester is associated with a more than 20% decline in the probability of graduating high school. So to your point, Dr. Ott said about absences, I think we will see some form of decline in school performance and achievement.
So Milen, and then Heather.
Thank you, all of you guys. That was really an excellent presentation. I'm wondering, over the course of your research, have you found any suggestion or any opportunity for industry to have a positive altruistic effect on the educational opportunities for children? So even just a basic thing like, for instance, McDonald's, who offers free Wi-Fi, amplifying their Wi-Fi signal to the outside of their building so that people could park in the parking lot and do school from there, or something along those lines. I know our high school in our neighborhood where my kids go, they amplified their Wi-Fi signal so everybody could go to the parking lot, download whatever documents they wanted, and then make use of them at home. I'm wondering if industry, if you've come across any evidence of that happening, or if you see any opportunities for that.
One thing I saw was that in France, what they already had established was sort of a compendium of virtual learning topics, like pre-recorded videos and materials that became available once COVID hit. So I'm not sure if they became free or discounted or whatnot, but basically they became available to all students in France. So I think, going forward, if we could have sort of, pre-recorded material, which could be downloaded in advance, like you say, would be something that would be beneficial to, students that are living in, rural places that might not have access to really good internet. And right now, I think in Canada, we just don't have, our curriculum fully available online and pre-recorded and stuff.
Heather?
Thank you, Karen. Sorry, I don't have a webcam on this computer. Everyone, that was an excellent topic. I just put in the comments that I would say every single one of my inpatients and outpatients comment on the change in schooling and the impact, and some of these leading to actually inpatient admissions. But the comment I was going to make, and I don't have a Bachelor of Education per se, but I field many questions for my children's school as well as a mom, and many of my outpatients are in the 3, 4, 5, 6, 7 age range. We get referrals for developmental delay, school problems, things like that. And I did find one reference that I thought was really interesting that talked about the impact on senior kindergarten grade 1, because these were going to be times where you should be having very solid early literacy skills, and that's where you start to read. And the weaker children, as soon as they basically lost last year, right? Because, from March to June, Zoom was like, the online learning wasn't well established, things were being sent home. It was going to be up to the parents, and in different socioeconomic situations that wasn't possible, nor are all parents going to be good early childhood educators as well. And then they saw that the senior kindergartens went to grade 1, or the grade 1 went to grade 2. And then you just uptook that curriculum, assuming that the basis of senior kindergarten and grade 1 existed, and then it didn't. And I think it's having that lens on that population just from early literacy, I think is going to really be problematic going forward with that. So, and then also the other thing exactly that you said is that the kindergartners and the grade 1s really are not even engaging in January, right? They just can't sit in front of the screen that time. Even the best best behaved children can't interact as well. And then parents have said that if you have 30 kids in the class, the teacher can't see all those people on the screen, and the more silent ones definitely get neglected. So thank you for highlighting this topic.
So we are now past our time. I would just like to thank all of you for the great work in bringing this forward, and we learned a lot from what you've presented, and it probably gave us a lot more food for thought around the children we see and the challenges that they face through this particular period. So thank you, and we'll draw it to a close.